Here's my final presentation project for Keen 4694 over my 300-hour internship at King Physical Therapy and Wellness Clinic. My site supervisor was Scott King. My internship was located in Early, Texas. I was classified as a physical therapy technician, and the mission at King Physical Therapy is to provide our patients with quality care through physical therapy and sports medicine. Scott King has worked in many different types of physical therapy settings, such as a rural hospital, inpatient clinics, and now owns his own outpatient clinic. The services that are provided are pre-operative physical therapy, post-operative physical therapy, free sports injury, aquatic therapy, athletic training, and sports medicine, as well as stroke recovery. Here's a couple internship objectives. Learn how to work effectively with all age groups. This internship provided me experience with a wide variety of ages. This allowed me to learn which age group I would prefer working with in the future. The second objective is enhance my development of skills such as teamwork, communication, and attention to detail. This opportunity allowed me to increase my ability to work with others. All the physical therapy technicians had to communicate and work with each other to help our patients recover properly. I definitely had to work on my attention to detail because two patients could come in with the same injuries, but their required exercises are completely different. The third objective is to learn all the physical therapy exercise abbreviations. When I first started my internship, I didn't know majority of the exercise abbreviations. However, now nearing the end of my internship, I can read a patient's chart and know exactly what exercises they need to complete. The fourth objective is gaining understanding of the patient evaluation process in order to determine when to modify rehabilitation exercises by learning how to take progressive measurements. This internship gave me the experience of knowing when and how to modify an exercise to gain the patient's best outcome. This allowed the patient to keep moving forward in the rehabilitation process, but also not be in pain during the whole exercise. The last objective is observing a patient's discharge evaluation in order to gain understanding of when a patient has regained his or her optimal range of motion and or stability after physical therapy. I was able to watch and help a patient from start to end. I watched their initial evaluation, helped them with their exercise, as well as observed their discharge evaluation. I was able to gain experience from every aspect. For my best experience, I would say it would be being able to see a patient from the start to the end of their physical therapy journey was one of my top favorites. I was able to watch as they progressed forward and even help them through their hardships. I loved being able to go back and see on paper how this patient has improved, being able to physically show them that they are gaining their strength and mobility back by increasing their weight and resistant bands throughout their physical therapy time frame. One of my most challenging experiences would be trying to determine what exercise would be best for a patient to achieve their specific goal. I had a patient who suffered from a stroke and was unable to walk without assistance, had trouble with her speech and language capabilities, along with her cognitive ability being affected. Her biggest goal she wanted to achieve after physical therapy was being able to hold her newest member of the family. So we tried to cater her exercises that were geared towards that specific goal, such as gaining her strength back in her upper body, along with being able to live for the most part without any assistance. Due to her medical condition, she is currently needing round-the-clock care from a provider. However, she is hoping that she'll be able to gain some of her independence back. Something I would do differently if I was able to redo my internship over would be ask more questions. I wish I would have asked my supervisor more questions about behind the scenes of a physical therapy clinic. Ask about how each different insurance works, ask about how the charting and notes and how it affects the patient's billing. Ask more questions about what guideline he follows when recommending exercise and number of sessions per week for each patient. I should have asked as many questions as possible to soak up as much information that I could. One of the most important professional lessons I learned, what I think my best and most resourceful experience at King Physical Therapy and Wellness was learning how to be professional with all the patients, but also finding a way to connect with them on a personal level. I was able to learn how to create professional relationships with my patients and coworkers, as well as connect with them on a personal level. The patients that I helped treat were amazing. I loved getting to know them and their lives and learn about what their goal was beyond physical therapy. Here are a couple of pictures from my favorite patients while they were completing their exercises. I absolutely enjoyed my internship experience. I'm beyond thankful for all the lessons I learned and meeting and working with the people at King Physical Therapy and Wellness Clinic.